Good morning, everyone. We are right at 10 o'clock, so we'll go ahead and get started. Welcome to Golden Zoomies, the August 31 Golden Zoomies. My name is Carol Borchert. I'm the Chief Marketing Officer at Morris Animal Foundation. I'm so excited to be here with you this morning and with our amazing speakers. You really have the benefit of decades and decades of knowledge and expertise that we just are so fortunate to have with us this morning. So I'd like to have a couple of our staff members who are here introduce themselves. Amy and Emily.
Hello, I am Emily. I'm the Girls Operations Coordinator for the Golden Retriever Lifetime Study. So I am on the contact center and I kind of make things work how they should. So there's a chance that you have all spoken to me if you've reached out to the contact center.
Hi, everyone. I'm Amy Torres. I'm the Executive Assistant for Scientific Programs. So I just help keep the department running and help coordinate between all of our team members. Thanks.
Thank you, Amy. Thank you, Emily. Emily just has a few housekeeping things to go through before we get into our presentation. So Emily, I'll hand it back over to you.
Yeah, definitely. So as you can see on our housekeeping slide here, we have a Q&A session that will take place at the end of the webinar. As we're going through all of these presentations, you can submit your questions using the Q&A feature that is at the bottom of your screen. There's two different things that have chat bubbles. The one with two chat bubbles that says Q&A, that's where you'll submit your questions. You'll just type them in and they'll be available for us as we go through. We'll pick those up and answer them. The other option, that chat option, you can use that for any kind of, if you have tech issues, if maybe you can't, if you can't see the slides or if you can't hear someone, if something weird is going on, you can put the that in the chat function. That's not, we're not going to be answering questions from there, so be sure you put your questions in the Q&A feature. As you can see on the screen, there is a blurb about closed captioning. Unfortunately, it's not set up for this presentation. We just had a little bit of technical issues, so unfortunately, we don't have the closed captioning and live transcription for this, this presentation. I do apologize about that. And again, use that chat function if you have any technical issues that you need help with.
All right. Thank you, Emily. So on to the day's topics. Today's topics are definitely more challenging, but the Golden Retriever Lifetime Study began in 2012, and we just celebrated our 10-year anniversary. And our dogs, they're getting older, and they're starting to have, more issues with pain management. And of course, as the days and months and years go by, we're losing more of our dogs. So even though the topics that we have on our agenda today are more challenging and difficult, it's critically important to have this information, I think, to help us all normalize what grief looks like and loss is like, and to know that our experiences are shared experiences, and to also learn more about pain management. It wasn't too long ago that dogs were thought not to really feel pain in the same way that others felt pain, and they were so stoic, but much of that was due to a survival instinct, right? To hide pain. And so we have with us today, Dr. Robin Downing, who truly, I think, is one of the world's leading experts in pain management. Dr. Downing has a clinic in Windsor here in Colorado, which is to me, I think, kind of an epicenter of best practices in pain management, as well as pioneering methods that will help our dogs live their best lives for as long as they can. So we'll be talking about pain management first off with Dr. Downing and with Dr. Sheila Robertson, and then Dr. Lori Kogan will be taking us into grief and loss. And so that's kind of the agenda of our speakers. I'll be wrapping things up, just giving everyone some information about Forever Memorials, which is an online digital platform for creating memorials for our pets. So we will kick it off first with Dr. Robin Downing. So Dr. Downing, thank you so much for being with us today. I have to say too, that Dr. Downing is on our board of trustees at Morris Animal Foundation. So we have the benefit of her knowledge and wisdom at the foundation, day to day, in addition to the incredible work that she does for pain management globally, and also for her patients. She sees a lot of patients. So Dr. Downing, I'm going to hand it over to you, and thank you so much for being here with us today.
Thank you so much, Carol, and thanks to my colleagues, Doctors Robertson and Kogan. It's really my honor to be on a panel with them because they're two of the most knowledgeable people I know. Thanks to the rest of the team at Morris Animal Foundation who's making this Zoomies presentation possible. And most importantly, thank you to all of you who are in attendance today. So I'm going to make the opening salvo here today. And my opening salvo is basically to seek a niche of mind. Carol made a really important point that unfortunately, dogs tend to be really stoic critters. And so they really live to be dogs. And what that means is they will mask their discomfort and their pain in ways that make it a really elusive process for us to understand that their bodies are changing and that they are having medical issues that really demand our attention. And so what I hope to do here is just paint in broad strokes and create a little bit of an overview of like what to expect and what should we look for and how will we as dog owners interface with our veterinarians to better understand how our dogs' bodies are changing. So when we think about pain in dogs, what we now understand from current data is that as many as 20 to 25% of dogs across all ages may suffer from painful osteoarthritis. That's potentially 1 in 4 dogs. And of course, the incidence rate, intuitively we understand, increases as these dogs age. And we've already alluded to the fact that dogs live to mask their pain, but it's really important to understand that in particularly stoic breeds like the Golden Retriever, this is really potentially a problem. So how do we know that our dogs are painful? Realistically, the most important piece that dog owners need to really wrap their heads around is that we're looking for behavior changes. Not specific behaviors, but behavior changes. It's important to understand that dogs don't typically moan or groan like we humans do. I'm an aging person and I deal with some chronic pain, and I've been known to say ouch really loud. Dogs just don't do that. So we have to look at how their behavior changes over time for us to better understand and appreciate when they are painful. So what are some of those behavior changes we should watch for? Well, decreased stamina or decreased interest in going for a walk or going for the run, decreased interest in play or a decreased period of play. For instance, I had a golden who loved chasing that ball, chasing that ball, chasing that ball. And instead of 30 reps, she dropped to 20. That was a behavior change that was a marker that she was beginning to develop osteoarthritis. Changes in sleep patterns. So some dogs who are painful will sleep more. Some dogs who are painful will sleep less and will be restless at night and up and pacing. Changes in eating patterns. Sometimes they will have a decrease in appetite. And sometimes it's not a decrease in appetite, it's uncomfortable for them to eat. For instance, if we have a Golden Retriever who's developing low back pain from osteoarthritis, it may be painful for them to reach to the floor to eat and drink. And so what we witness is, oh, she's not eating like she normally does, when in reality, it's because it hurts every time she reaches to the floor. We may have changes in family interactions. So we may have a dog that becomes really clingy. We may have a dog who separates from what's going on in the family. We may have a dog who becomes intolerant of young people in the household because they know that if they get touched, it will hurt. We also may see changes in that dog's interactions with other pets in the household, other dogs, cats, changes in those interactions, getting a little snippy or a little snappy with those animals. And we may see changes in house training. We may have a dog who is just not so comfortable to go through the doggy door, to go outside and go to the bathroom. And so we may see breaks in house training behaviors. It's really critically important that anyone as dog owner brings up any behavior change during a veterinary visit. And videos are even more useful. So now that we all wear a camera in our pockets, it's really easy to say to your veterinarian, you know, my dog used to just like assume the position and poop everything all in one place. And now watch this. And we see that dog literally walking across the yard, having a very difficult time assuming the position to defecate. That is hugely useful. The other reason that videos are so useful is that you can record behavior and movement in the normal, natural home setting. Some of you understand that. If you have kids, it's been sick all week, you go to the pediatrician's office and all of a sudden everything's good. Well, dogs can do the same thing with a little adrenal dump if they come to the veterinarian's office, and they may behave perfectly normally in that exam room. And you know they haven't been normal at home. So what can you expect about the veterinary visit? Well, first of all, we're going to do a good general exam. But what we now understand is that in the context of a regular general exam, we need to do a careful pain palpation with range of motion. And if we are dealing with a dog that we actually understand and uncover is painful, we're probably going to want to do some lab work. And why we do that is to identify any underlying medical issues, but also to help make medical decisions, medication decisions. We don't want to cause harm with the medications we choose. And we also need a baseline for future comparison. This allows us as veterinarians to create a very personalized, and this is important, multimodal pain management strategy. So what is a multimodal pain management strategy? Well, a multimodal pain plan addresses that dog's pain from literally multiple directions. So what I tell my clients to think about is imagine your dog as the hub of a wheel, and each of the treatment modalities that I'm going to prescribe as a pain expert are going to be spokes on that wheel. And the treatment categories fall into a couple of really broad general categories. There's pharma, that's medications. There's non-pharma, and that typically includes nutritional supplements that may behave like medication but aren't drugs, physical medicine, and then environmental modifications. And I want to address each of these in turn. So when we think about pharma, the cornerstone of managing chronic pain that comes from the inflammation associated with osteoarthritis are the non-steroidal anti-inflammatory drugs, or NSAIDs. These drugs that are in use for dogs are all very safe and effective, and they really can be used long-term. It's critically important that you never, ever, ever reach for a medication out of your own medicine cabinet. We also now think about the reality that when pain's been in place for a while, it transforms the nervous system at the level of the spinal cord, as well as at the level of where the pain happens, into something called chronic maladaptive pain. Maladaptive pain involves the nerves, and we need to use neuroactive agents. There's also this category, it's actually a single agent here in the US that goes by the abbreviation of PS-GAGs, polysulfated polysulfated aminoglycosides. So this is why we say PS gags, because even I stumble over that. The PS gags are injectable, and in a setting that is a little bit outside of what the Food and Drug Administration has deemed for these medications, we actually use these for clients to inject at home, so that will save them the expense and the travel of coming to my office. But one of the really cool breakthroughs that I think Dr. Robertson is going to talk more about is this category called monoclonal antibodies. This is really one of the most important breakthroughs in my 36-year career as a veterinarian. There have been a few really key breakthroughs. This is going to be a huge one in veterinary pain management. Another big breakthrough is the use of radioactive isotopes. These are molecules that have been altered to actually emit electrons, and have been proven to address very specific pain conditions in dogs. Bottom line is, pharma remains an active area of research in this quest for the best pain management strategies for our dogs. So what about non-pharma options? So I mentioned compounds that behave like medication but aren't medication. We call these nutraceuticals, nutritional supplements with a medicinal effect, but they're not drugs. Please do not rely on Dr. Google for recommendations about nutraceuticals, because unfortunately, it's a bit of a wild west out there. And really, it's your veterinarian who will have access to the most evidence-based use of these compounds and will provide a prescription, a recommendation for what is specifically best for your particular dog. These compounds make excellent complements to the pharma piece. So then when we shift our focus to physical medicine, I would give you the fact that in my background, I'm credentialed in medical acupuncture, I'm credentialed in medical massage for dogs. I also am credentialed in animal chiropractic, and I'm a diplomate of the American College of Veterinary Sports Medicine and Rehabilitation. So physical medicine has been a huge part of my pain management practice for now going on 2 decades. So we have physiotherapy as a very broad category. And this will include things like hydrotherapy, working out in water, as well as some of the modalities that go along with physiotherapy, manual therapies, if you will. But I include in this umbrella of physiotherapy, therapeutic exercise at home. I commonly prescribe and send clients home with homework. This is what you will do in between our visits. I already mentioned medical acupuncture, which utilizes the nervous system in ways to assist with pain management. Medical massage I can provide in my clinic, but where I find this modality to be most useful is when I am able to teach my clients how to do medical massage techniques at home, again, to provide support in between our visits. And then one of the physical medicine technologies that I commonly use is called targeted pulsed electromagnetic field therapy, or TPEMF. And this is a therapy that we can utilize either in the practice or much more commonly at home in between veterinary visits. Photobiomodulation is the term we now use when we talk about utilizing light energy or laser to help us with both tissue support as well as pain management. And ECTSWT, extracorporeal shockwave therapy. This is a relatively new entry into the pain management arena. And it is, we're starting to see some really good data generated to let us know that in the physical space of my clinic, this is a technique that will become more and more important as we get more data about how best to use it. This concept of environmental modifications is unfortunately one area that it pains me greatly that many veterinarians simply overlook. just don't think that this is on their radar, and it should be, because we can, as veterinarians, make very specific guidance about how to modify the home environment to help a painful dog not be painful, how to help a painful dog be more mobile as their pain management kicks in and they're feeling better. This is where home video, home pictures become so critical. So some easy things, raising food and water dishes. I mentioned earlier that some dogs who are painful in their back or rear quarters will be reluctant to reach to the floor because it hurts when they reach to the floor. Making sure that we cover slick floor surfaces. We have options to do that now that do not involve laying down permanent wall-to-wall carpet. And this is a very important piece in managing mobility. Restricting access to stairs. And what I mean here is restricting unsupervised access to stairs, because we don't want a dog to take a tumble down the stairs and make a bigger problem than we already have. And easier access to outdoors to go potty. So if we have a dog who's beginning to have some issues retaining urine in a stool, it may be appropriate for us to think about creating a doggy door into an enclosed place outside that is easy for them to access in and out. This is when I talk to my clients who have big dogs. I talk about this when those dogs are puppies, and that's teaching those dogs to use a ramp for entry and exit into and out of a vehicle. If we teach them when they're young, they will not have to be the old dog who learns a new trick. And this really is a way for us to not have a dog experience the concussive forces of jumping into and out of a vehicle. The same with modified access to furniture. There's so many cool things out there to help us help a dog step up onto and off of the sofa, a bed, and modifying activity and exercise. So when I have an older dog who is experiencing osteoarthritis and we are managing their pain, I do talk to people about retiring those dogs from sudden concussive starts and stops, no frisbee. We might stop chasing the ball. And instead, with long walks, instead of doing an hour and a half walk all at once, to help them understand that 20-minute walks multiple times during the day actually have a cumulative positive effect. And then finally, assistive devices. This ranges anywhere from vests with handles that allow us to actually help a dog get up, supervise them as they're going downstairs, to wheelchairs to assist dogs who are weak in the rear quarters. We even have 4-wheel wheelchairs to help those dogs that are weak in all 4 limbs. We have the ability to utilize so many different things that are now available to help us help dogs by providing assistive devices that they easily learn how to accept, because we teach them that this means they're going to have access to the kind of lifestyle to which they have become accustomed. And with that, I would like to hand things off to my friend and colleague, Dr. Sheila Robertson.
Dr. Robertson, you are muted.
Yeah.
And before we get going, just giving Dr. Robertson a couple minutes
Okay.
here. I did
I'm here.
have a couple questions for Dr. Downing before we hand over to Dr. Robertson, if you don't mind. And these are really for my own curiosity, but I'm sure some of our owners here might have this question as well. The first one deals with you talked a little bit about the Wild West for supplements, and I think it is the insane Wild West when we talk about CBD. They promise the moon and the stars and the planets, but maybe Dr. Downing, could you just, let our owners know the state of research into CBD supplementation and creams and what that might mean for pain management?
So you're correct to state that the CBD place is a really Wild West place. There are 2 CBD products that have been evaluated in a way that there's actually been peer-reviewed literature published. The first and really the one with the most robust research to back it up is a product that was first evaluated at the University of Pennsylvania Veterinary School, and that is compound created by the Alabek company. The other is a compound that we actually did a prospective pilot study in my pain management referral practice, produced by a company called Pet My Pet. It's really important to, at this point, access what is in the evidence-based literature, and that means really accessing your veterinarian for that expertise and that knowledge. As far as CBD compounds that are placed into gels or creams with the wild claim that it will somehow penetrate into the tissues and make a difference, we have a really excellent pharmacologist in the veterinary field named Dawn Booth, who has done some amazing research to really debunk the idea that we can just put a compound into a cream and rub it on a dog or a cat and have it do something useful. And so I would just caution dog owners to really access your veterinarian for information around CBD. It's an active area of research, no question. And the researchers who are doing this, the science, are looking for, what are the applications? Where will it be effective? And most importantly, what are the compounds we should be considering that will not cause harm and will in fact do good on behalf of our patients? So this is one of those, put a pin in it and keep your eye on that space. And Dr. Robertson, I don't know if you have a follow-on comment about that.
No, my, what I say when, a lot of patients I see are already taking a CBD based product. It's basically knowing what should be available from the company. And unless the product is, made from organically grown product, a lot of the imported product from China and India, actually, when you have it analyzed, has heavy metals in it, stuff that are, lead, all sorts of different things. So a reputable company should be able to give you any data they have on research, and they should have a certificate of analysis. That's the main thing to ask for, is a certificate of analysis. And that will let you know whether or not they're reputable and if they have that done independently. That would be pretty key to me.
Right. Wonderful. Thank you so much. Definitely an area to keep a pin in and keep track of. Dr. Downing, thank you very much. I know you're going to hang out here in case we have more questions from our attendees. Dr. Sheila Robertson is joining us now, and Dr. Robertson is the director of Lap of Love Veterinary Hospice. They do incredible work with end-of-life care and pain management, as well as grief and loss. So Dr. Robertson, thank you for joining us today, and hand it over to you.
Yeah, well, thank you, Robin, first of all, for setting up, what a huge sort of area of interest this is for us, and how much we know. I've been a veterinarian now for actually 42 years, and the way that pain management has changed is dramatic. And I now think that pain is really like a puzzle, but our job is to solve the puzzle in each of the patients that we see in our daily practice. And so, we've got an owner here and she's worried about her dog. And we know that these older dogs do get a very, very high prevalence of osteoarthritis. It may even be higher than 25%. Some people are saying 40% of dogs will develop debilitating osteoarthritis in their lifetime. And the thing about osteoarthritis, it's a disease of the joints, but it causes a lot of changes in the central nervous system and how the animal perceives life in general, because pain is an emotion and pain is always unpleasant. So the puzzle is to figure out, what's causing the problem, how long it's been there, because the longer it's been there before people have come for help, the harder it is to help the animal because of the changes that have occurred. And then just like us, not, the same drug isn't going to work for every patient. We all take something different for a headache, and it's our job to figure out what's going to work for this particular patient. And when we're looking, for me, when I'm looking at a case and it is chronic, or as Robin said, maladaptive pain, which really serves no function, it's not protecting the animal, it's just causing a lot of suffering, we need to sit down with the owners and talk about several things. And we always, at the core of my conversations, are what are the owners' budgets? And when I bring up budgets, everyone automatically assumes that I'm talking about how much money do you have to spend on your dog? And that's not at all what I am talking about. Now, financial concerns do come in to it. If you're, can take your dog to a rehab center, once or twice a week, that costs money. But that's not the only thing that we're talking about when we talk about budgets. Is how much time do you have to devote to helping your dog? And I really promote the use of in-home therapy. So teaching owners, as Robin said, to do massage, exercise, and so on. And then we have the emotional budget, because, this dog has been a family member for, 10, 12, 14 or longer years. And we know it's developing some chronic serious problems. So some therapies will work and some don't. So there can be an emotional roller coaster. And then the physical budget is, in these larger dogs, actually helping them get up and so on. If the owner is a frail 90-year-old person, that's going to be tough for them. So these are all the budgets that we discuss, and we come up with a plan to make sure all the budgets are met and have a goal for that particular patient and their family. But at the center of all treatment has got to be quality of life, because we don't want to just extend life, we want to extend a good quality of life. So if we can help them, we want the time that we're adding to their life to be good. And quality of life is quite difficult to really explain what it is in an animal that can't talk to us and tell us. But I would say the easiest way is to say it's how an animal feels about its current circumstances. And this is because we may choose to put a dog through a treatment that has some unpleasant side effects. Now, if it was us, we would know that tomorrow might be a better day, or is likely to be a better day. But dogs live in the here and now. So it's even more important that what we're doing helps them on that day, every day that we're helping them. And then, of course, when we can no longer help them, that big discussion about saying goodbye is what has to happen. And certainly people know that once their dog is getting old, and those discussions can start at any time during treatment. But we know from a lot of research that there are 4 key elements to a dog having a good quality of life. And they fall into the being content and happy, being comfort and active, being calm and relaxed, and being enthusiastic and energetic about life. And this is really just, totally agreeing with what's already been said. So these are the 4 key elements of a good life and good quality of life. And we need to monitor these during treatment in case one of them slips. What's going on? What can we do to get all of these elements, being acceptably good for that family and that dog? So clearly from those 4 key components, we're not just talking about their physical health, like that they have osteoarthritis or they have a much more painful condition, which a lot of the listeners will know about in the larger dogs, osteosarcoma, so bone cancer. We're talking very much about their mental health. So as veterinarians, we used to in the past just be trained and focus on physical health, but it's absolutely clear now that physical and mental health can't really be separated when we're treating a dog. And when we treat chronic conditions like arthritis, it is done with drugs and with non-drug therapies. So it is a comprehensive plan and it's integrative. So it's very holistic and it's an integrated plan. So if we take this dog, who's obviously a true gray muzzle, and we think about osteoarthritis, pain and inflammation in the joint. And that means they don't want to exercise, less exercise. What does that mean? That means weight gain. And what does that mean? That means more joint stress. And we get into this vicious cycle of, it just goes, it doesn't go in a good direction. So the key is to figure out how to make that dog comfortable. How do we decrease the pain and inflammation so we can get them to move, lose weight, and so on? And that used to be the main reason why we were very, very emphatic about dogs maintaining a good body condition score and muscle condition score and not getting overweight. But we now have another really important reason why dogs must not get overweight, because we now know that fat is actually one of the sources of the inflammatory molecules that cause lots of problems in the body, chronic diseases, a lot of inflammatory. And if we can drop the content of fat in the dog, then that background inflammatory state can be diminished very, very greatly. So just as Robin said, the first go-to drug for osteoarthritis and other types of maladaptive pain are the anti-inflammatory drugs. Now, these are veterinary approved drugs that have gone through, very, very rigorous review and testing that is demanded by the FDA before they're allowed to go on the market. And they are mandated, the companies that produce and sell these, that they monitor any adverse side effects of these drugs after they're launched. So they have what they call pharmacovigilance. And we can see from the millions of doses that have been dispensed, we can see how few adverse side effects there actually are with these drugs when they're used correctly. And then Robin was talking about changes in the nervous system that happens with chronic pain. And one of the drugs that is often added, so it's kind of a multimodal pharmacologic approach that's added to the nonsteroidals, is a drug called amantadine. And that helps kind of like settle the central nervous system. It kind of works at the gate where a lot of the changes are happening in the spinal cord. So a lot of you may have had that suggested or added to your protocol by your veterinarian. But the one thing that to me is key in helping these dogs with chronic pain and helping them enjoy life is exercise. Now, when they have sore joints, as we already know, they don't want to play catch with the ball. They don't want to go for a long walk. So this is why swimming in water, so aquatherapy, whether it's in a pond or at a referral center that has underwater treadmills, it lessens the stress on their body. It makes it easier for them to exercise and get their joints, really working well lubricated and burning calories at the same time. Another thing, because these animals, getting them to a veterinarian and back and forth can be a problem depending where you live, what access you have. So we do a lot of in-home training of owners. So this is me at a house. And this is one of the gray muzzles that lives in this house. And she has mobility issues and she has arthritis and she has degenerative myelopathy. But what we've done in the house is they have carpet, very important that this is not a tile floor. If it had been a tile floor, there would be yoga mats and rugs put down. But we've put an old shower rod across the hallway, and just, you know, to earn a treat, we have her lift her legs up and walk over back and forth. This is something owners can do, and it's entertaining for the dog as well. So motion is pain medicine, but more. So physical activity, I work with geriatricians at the University of Florida, and this is key to their approach with older people. So physical activity actually has a positive effect on cognition, and we know that cognitive dysfunction happens in older dogs, and if they stay physically active, you can delay that. It helps maintain muscle mass and strength. It's a mood enhancer, right? Exercise is a mood enhancer, helps most chronic diseases, and actually guards against frailty, which we recognize in dogs and, of course, people. The other key, which is often overlooked, and I would say this is the one thing that's overlooked a lot with a pain management plan by veterinarians, and that is the effect of anxiety and stress on pain. So anxiety and stress drive pain, and pain itself causes anxiety and stress in the animal. So it's a vicious cycle. They're feeding on each other. But we know from a lot of science in rodent models, we know in people, that physical activity and a socially enriched environment reduce pain behaviors, which is what we're looking at. And actually, in some very clever research, they can show that it normalizes brain function, like the perception of pain. So this is all to do with like thinking outside the box. For example, these are two dogs in my neighborhood, truly, you know, old muzzles that are very much loved. So they still have to go outside to enjoy themselves, and it's fun. They meet all the other dogs in the neighborhood. So they walk for a while, and then they get into their double-decker Red Ryder, and they're having the time of their lives, even though they have arthritis. So if you think about this combination of anxiety and pain driving each other, we need to incorporate all the things that I've put up here, the cognitive therapies like brain games, and it's like distraction. So we're distracting them. Good quality rest, positive social interactions, away from toddlers that might want to, you know, tug on them, and so on. Exercise, massage at home, and then this decreasing stress in the home. So these are all part of treating pain, even though these are not magic bullet drugs. The other thing that is a huge puzzle, and to me, this is no surprise, because I got set up so nicely by Robin by saying that everything we look at is based on behavior. And what we're now finding out is that behaviorists, so they're a specialty in veterinary medicine, behaviorists are now looking at or reviewing all their cases. And what they're seeing is that in a recent review of 100 dogs that were referred because of a behavior problem, at least a third of them had some underlying painful condition. So this wasn't a dog that truly had a behavioral issue. It had a pain problem causing the change in behavior. So dogs that suddenly at an older age became aversive to noise, when they treated them, because all of them that were seen had osteoarthritis, they treated the arthritis and the noise aversion went away. Defensive behavior, of course you defend yourself if you're painful and don't want to be touched, and aggression, and things like agility dogs whose performance, tapers off. So, the authors, I talked to these authors, and they said it's probably up to 80% of our referrals have some sort of pain, and when we treat the pain, we help the problem. So it's really important to recognize the connection between pain and problem behavior in animals, because it's not really a problem behavior. It's being caused by pain that has been overlooked and not treated. And the future is looking very, very bright for pain management in veterinary medicine. And Robin alluded to this. This is probably one of the most exciting things that's happened in my long career in veterinary medicine. And this is the development of monoclonal antibodies. These are biologics that actually tackle pain at a very specific target site. So the listeners may know about a very famous monoclonal antibody that's used in humans called Humira, and that's for rheumatoid arthritis or for Crohn's, ulcerative colitis. Well, now we have a very specific monoclonal antibody to treat osteoarthritis pain in dogs and also in cats. Now, the cat one is currently being launched in the United States, been available in Europe for over 2 years. And the dog one, this one, Librela, is available in Europe and will be coming to the United States. And it's a once a month injection. And the results have been beyond everybody's expectations. So this is something that I am so happy to see happening in the veterinary world. So it's looking good, I think, and pain is at the forefront of a lot of major research problems and you know, people looking at these and also being, you know, luckily very, very well funded by Morris Animal Foundation. So thank you.
Thank you so much, Dr. Robertson. I think it shines a huge spotlight on all the things people can do to help their painful pets. And the research is exciting.
Yeah.
I want to just jump right over to Dr. Lori Kogan. So Lori has plenty of time for her topic. Dr. Kogan joins us from Colorado State University, where she is a professor in the Department of Clinical Sciences at the College of Veterinary Medicine and Biomedical Sciences. So she plays an important role in that college in terms of counseling, particularly veterinary students. But Dr. Kogan, if you'd like to go ahead, and we'll try to make up a little bit of time, please feel free to go over a bit if you need to, and we'll let you have the time that you need. I know it's not nearly enough to present on pet loss and grief. Thank you.
Thank you. And what an honor to be here and to follow such great speakers. And what this is a very, very, very quick overview of some grief and loss issues. And really, I just kind of want to set the stage, just to give you some things to think about. And hopefully, you know, we end on a positive note. Sometimes this topic can be a little bit of a downer, but we're not going to kind of delve into it so much. We just want to kind of plant some seeds. So first we just talk about how much we all really love our dogs, right? And I know it's kind of preaching to the choir, but there are so many benefits that we get from sharing our lives with our dogs. Physical and psychological benefits, and certainly a ton of emotional benefits. And they just truly enrich our lives in ways that I'm sure that all of you feel like are numerous, right? And we tend to show our love in many different ways. And I'm sure that many of you can attest to doing some of these things. But as far as including in holiday celebrations, you know, maybe you prepare special meals, maybe with Halloween around the corner, maybe there's things that you do to have them celebrate with you, and especially as the holidays are starting to come up. So we have all of these benefits, and then at some point, inevitably, that we need to say goodbye to our pets. And so that can be a very, very difficult situation for many of us. And so grief and loss is impacted by lots of different variables, and certainly the circumstances that are involved is going to impact our grief and loss. And so it's very different scenario if this is something that is traumatic, if it's an emergency situation, versus if it's something natural, you know, without warning, or for many of us, it's a planned euthanasia. And we don't have time to get into some of those factors today, but for planned euthanasia, there's so much that goes into deciding when is the right time to say goodbye. It's an incredible responsibility that we have, and kind of trying to weigh that. And there's some fantastic quality of life scales out there to help you do that. So if you're starting to think about those types of things, you can talk to your veterinarian about these things, but using some type of scale where you're kind of objectively looking at what they still enjoy doing, good days versus bad days, those types of things can be really helpful. And I've stuck in a couple of these different slides about different research projects that I worked on that are kind of related to this topic, because I've done a fair amount on end of life issues. And this was a recent study that I did with some colleagues looking at different aspects of loss for service dogs, and the unique aspects of death and retirement, which retirement is it's a very unique aspect of loss for service dogs, and the impact that this has on their handlers. And the idea behind this type of loss is that it's not only the loss of their best friend, their companion, but it also really is the loss of their own personal quality of life, their freedom, their ability to do things. And so I think that it's important to understand that type of loss has some aspects that can be very different from pet loss. And then I just wanted to bring your attention to a couple different types of grief. And one is this idea of disenfranchised grief. And maybe some of you have heard this term before, but it's grief that's not really acknowledged by society. And oftentimes the loss of our pets falls underneath this umbrella, where this is a grief where it is extremely impactful to you, but maybe not recognized by those around you. So in our society, when we have a human family member that dies, there are a lot of things that are involved in that. There's a lot of rituals, there's a lot of traditional support that goes with that type of loss. Oftentimes with a pet loss, we don't have any of those types of things. And so it can make us feel kind of misunderstood or disconnected from those around us who otherwise we would feel close to, because it doesn't seem like that they get it, that they understand how hard that is. And disenfranchised grief can make it much more difficult for us to recover and to move on. Another grief that I just wanted to mention briefly is anticipatory grief. And my guess is that some of you, as your dogs are aging, are starting to think about this. And what that is it's this grief that comes from thinking about the loss that's going to occur. And it tends to be really relevant for those of us who have pets that are either getting older or have a terminal diagnosis. And so it's starting to think about what that loss is going to look like and what our life is going to look like. And it might be playing out those ending moments. And so that anticipatory grief, that is real. And acknowledging that that's one of the themes I'll come back to again in this short presentation, is that all these things are normal. And to not judge yourself and to just accept that this is a feeling that I'm having. And then I just wanted to take a minute to, as you're thinking about kind of end of life issues, there's another study that I did with colleagues looking at end of life support and after death body care. And I just wanted to put up this slide for you to kind of think about things that you might want to think about in terms of your relationship with your veterinarian as you're starting to think about some of these end of life issues, and that you want a veterinarian that does these things, right? Ideally. So you want a veterinarian that takes time to address your aftercare concerns, answers your questions. You want to feel like you're informed about what your options are for end of life issues and then for after death body care. You want a veterinarian that asks if you have a preference for things like a crematorium or a cemetery and then respects your decisions. And if you don't really know any, it'd be ideal if they gave you kind of some choices to choose from, as opposed to maybe one specific one. If they give you one specific one, maybe there's a reason why, and maybe exploring that. Ideally, also, they would have written explanations of all of the aftercare options and that those would include prices. And so again, it's this idea of that you come into these moments being fully informed and fully aware of what your options are, and that you want a veterinarian that then follows your choices, of course, carefully. So after a loss, we feel grief, and grief feels differently to everybody. And so it can encompass one or all of these different things. And so it might impact you physically, where, maybe you feel like you don't have an appetite. It might be more cognitively, where you have a difficulty understanding things or difficulty paying attention. You might feel like isolating, or you might feel like you really want to be with people all the time. And then all of the different emotions that come with this type of loss. And so sadness and depression and anger and all of those things, and recognizing that no matter how you feel grief, that it's okay, and maybe you don't feel really anything at all. And that's okay too, right? And then many people feel guilt and regret. And so, people sometimes think, was it my fault? Did I make the right decision? And euthanasia is such a difficult decision. And knowing, did I make the decision too soon? Did I make it too late? Should I have done more? And then when we get into decisions about things that maybe cost tens of thousands of dollars, there's those elements too, and so trying to be patient and loving with yourself, and recognizing that guilt is a prominent factor for many of us when we're facing these end of life issues with our pets. And so I want to spend just a little bit of time talking about mourning and what that might look like, and how you might work through some of that. And so mourning is that outward expression of grief. And it's really impacted by our own personal experiences, our culture, what's deemed acceptable. And so there's a wide variance in how people mourn. But I thought that these 6 needs of mourning that we're going to go over briefly might be helpful to you. And these come from Alan Wolfeld's work, who's done some just super incredible work on mourning and loss. And so I encourage you to look for his work if this is something that speaks to you. But the first part is just acknowledging the reality of the death, and just gently confronting that reality. And that means that your brain will probably flit in and out of your memory or what that experience was like. And that's part of the mourning process, and just being patient and kind with yourself as you kind of keep revisiting that acknowledgement of the death. And then as you revisit that, and as you play this out, then there's that pain that comes with the loss. And even though it is extremely difficult to do, to at least at times to embrace that pain. Lots of times we will avoid that. We will do all these things to distract ourselves, and that's okay. Sometimes we have to do that. Sometimes we have all these other responsibilities, and we have our job, and we have our life, and so I'm not saying that you have to dwell in that spot all the time, but in small doses, maybe allow yourself to feel some of that pain. And I encourage you to think about the fact that that's not really something that our society talks about a lot of the time. Lots of times we're kind of given this message that we need to be strong. And certainly people are uncomfortable with other people's grief. And so they will sometimes help distract you, or they'll say things that are not helpful. And just be cognizant of those messages that we get from other people, that oftentimes it's not that they don't mean well, but they're responding to their own discomfort and their own inability to take that pain away. And so they try to mask it. And so instead, just being accepting of the pain that you have and reframing your grief as something that means that you become aware, you become accustomed to that pain, and that you accept it, that it is going to be okay, and it is going to get better. There's a lot of work that talks about continuing your relationship with whomever has passed away. And so, years ago, we used to talk about, well, you got over your grief when you ended that relationship with that person or that animal. And now we know that that's not true, that you can look for ways to continue that bond. And that might be playing out different memories. It might be keeping objects that remind you of your dog, whether it's photos or whether it's their collar, and allowing yourself permission to pursue that relationship, and understanding that keeping that relationship doesn't mean that you're not healing or you're not getting better, that actually can be part of the process. And that it's up to you to decide what is comforting and helpful for you. And I just recently done a study looking at how people memorialize their pets. I submitted this for review. And I just put this up here so that you could see, this is just like the top 10 or so of things that people said that they do. And I just want you to recognize that that it's very individual, and lots of people do several of these things, and so, and then also there might be an element of comfort in these things. There might be an element of discomfort. And so it's up to you to say, is this helpful to me? Does this make me feel better? I know people that put up photos or keep photos, and then there are other people that it's too painful to look at them, or people that will make something out of their pet collar, or they will do something with the ashes of their dog, maybe make jewelry or something like that. So again, it's up to you to decide what is going to help you through this process. The next step that they talk about is finding a new normal. And so recognizing that for many of us, our dogs are so much an integral part of our life that a lot of our role has changed. A lot of our daily activities change. And so finding the new normal, finding the new you, what does that look like? What does your daily structure look like? What do your routines look like when you don't have your dog anymore? And so maybe being a pet parent was a big part of who you are. And so then who are you developing into next? And taking some time to think about, how do you want to reinvent yourself? And what does that look like? And part of that process might be searching for meaning. This might bring up more philosophical thoughts about, what is the meaning and purpose of life? What is the purpose of forming these relationships when we know that chances are that they're going to be short term? And just being patient with yourself when you have some of those thoughts, and recognizing that it's part of the process. And there's nothing like death to bring up this idea that we don't have control. And that makes us very, very uncomfortable, right? And so thinking about, are there different aspects that you do have control over? And can we come to that place of accepting that there are many aspects of our life that we truly don't? And that lots of times that kind of brings us back into what we can do is we can enjoy today. We can enjoy the time that we have with our loved ones, whether they're our dog or our family member, we can enjoy those things today. And then it's really important that we get support from others. And so seek out people that understand what this loss is. Many of us understand what this loss is about and have gone through something similar, and can be great support for you. And so making sure that you avail yourself to that type of support. And if there are people around you that give you messages of disenfranchising your loss, step away from them, right? And so if people say things that are not helpful, you need to step away from that. So people will say things like, oh, it's just a dog, or you can get another one, or and recognizing that that is not our reality, and that's okay. And so we need to be selective about who we seek out for support. And understanding through all of this that mourning is a process and that it takes a lot of time. And it's not something that we get over. And so that's not the goal. The goal is instead just to be able to live with it and to recognize that it's going to kind of ebb and flow. And we'll have these things that come up in our life that trigger these different memories. And sometimes those memories will make us happy, and sometimes they'll make us sad. And it's all just part of this process. And then my last slide was, I just wanted to offer a couple of thoughts about if you are in the position of wanting to support somebody else's grief. And so things that I would suggest that you avoid are cliches, which those are really easy to say, right? And so because we're searching for something to say, and we're searching for something that would help people feel better, it's okay to just say that you're really sorry. The biggest thing is to sit with someone through their pain and not feel the responsibility to take it away, because we cannot. Don't compare losses, and it's probably not a time for you to talk about like your loss if somebody else is in a tremendous state of loss. Not suggest a replacement. We all know that people respond differently to those types of things. So sometimes people that have lost a dog, they go out almost immediately and get another dog. That's how they cope. That's what works for them. Other people don't do that at all, right? And there's no right or wrong. And however you respond and however people that you care about respond, that's what works for them, okay? Not suggesting that people stay busy or distract. You know, when we talked about that just a minute ago, that we don't want to give people the message that their pain is not something that that they should embrace at times, right? And certainly we don't want to dismiss their feelings, which I know none of you would do. But again, it's just a matter of just being able to sit with them. So allowing their expression of their feelings, allowing them to talk, asking them, you know, do you want to tell me about your dog? And letting them share the good memories, or maybe the memories near the end that are painful, and acknowledging their loss, you know, and that can just be as simple as saying, I hear this was a tremendous loss for you, you know, and you don't have to say anything any more profound than that, right? And to try to not feel that urge to fill sometimes that silence, that just to let it be and let people be, and allowing time to grieve. And so people might need to talk to you about it again and again and again, and that's okay, you know, and you might need to talk to people again and again, and that's okay. So the whole idea is just to be able to sit with people through whatever grief or whatever rough feelings that they're having, and just be present with them. And there's something so grounding and solidifying in that. And so my last thoughts are that pet loss is definitely something that is unique for everyone. And for yourself and for the people that you really care about, what I would like to propose is that you come into this with an idea of having patience and compassion for yourself and for others, and acceptance of however you're feeling, and understanding that these waves of different feelings and these different things, that they're all kind of part of the process, and that rather than judging them, that you come from a place of acceptance. And one of my favorite expressions for any emotions that I'm having that feel a little bit uncomfortable to me, sometimes I'll just say, isn't that interesting? Isn't that interesting that right now I'm feeling really sad? Because there's no judgment to that. It just is what it is. And then I get to decide what I want to do with it after that point. But that's really the ultimate message is that I want you to hear today, is that all of this aspect, I mean, it's part of a natural part of having a dog, and that you just accept kind of wherever you're at during this stage of having a dog. So, and with that, I'll end and say thank you so much.
Thank you very, very much, Dr. Kogan. I know in my own experience, my last two dogs, Casey, our golden retriever, died after a long illness. And that grief was so different than our dog Jazz, who had a very sudden death from hemangiosarcoma. So just even within your own experience with your own pets, that loss can be incredibly different depending on the circumstances surrounding that death. And I think what we've all learned today is it's really be an advocate for yourself, seek information and ask questions. And although these are very, very large areas we've learned about today, and there's so much more. I know we could have done a Golden Zoomies again and again and again on all these topics. I just thank all of our presenters for giving valuable information that our participants can follow up on. And to that end, I'm going to check our QA and see if we have any outstanding questions we can answer really quick. For post Zoomies, we'll send out an email with a link to this presentation, and also PDFs of the slide decks we'll be able to provide. So keep an eye out for that. That should be coming out next week. And then we had another question about starting NSAIDs or early meds early in the diagnosis, and Dr. Robertson responded to that in the chat. Before we run out of time, though, I also want to just touch base. I kind of jumped the gun here. We have a little bit of a presentation on our forever memorials that we wanted to end with, in which Dr. Kogan kind of served up really, really well. Amy, can you or Emily put up those slides? It's just take me a real quick second to run through these and go to the next slide. So because we know how important it is to have support when you're going through a loss, and Dr. Kogan listed a lot of the ways that people do that, we realized there was a big, wide open space for a place where people could share their memories about their pets. And Morris Animal Foundation, we launched Forever Memorials. So this is an online digital platform where you can share your photos and stories and memories. People can give you messages of support. You can also share on social from there. And of course, if you have friends or family who want to make a memorial gift in honor of your pet, that option is there as well. Go to the next slide. So this is if you go to the top navigation, you'll see next to the Golden Retriever Lifetime Study, a little click where it says Forever Memorials. And that's where you would go to begin your Forever Memorial creation. And if you go to the next slide, this is kind of what it looks like on the screen. So this memorial has been created for Remington May. And you can add as many photos as you'd like. You can share memories. You can provide links to this page. And as I said, share on social. So it's just a great place to come to share your pet story, to keep those memories alive, and also to be a celebration of your pet's life. So really quickly, just wanted to touch base on Forever Memorials, and you can get there through the Morris Animal Foundation website. All right, so back over to our speakers. Are there any questions out there that we can get to really quick before we wrap up today? Let's see what else we have here. Does gabapentin paired with NSAIDs work the same as amantadine with NSAIDs? And then Dr. Robin Downing provided, maybe you want to read that answer, Dr.
Yeah,
Downing.
so it doesn't work on the same place in the central nervous system, but in my now years of clinical experience, I actually rely much more heavily on gabapentin because of where it acts and how it acts. And I do have a paper, and Dr. Kogan is actually a co-author on this paper in the peer-reviewed literature about the use of gabapentin in chronically painful dogs. We did a retrospective study of 240 dogs in my pain management referral practice, articulating the use of gabapentin and appropriate dosing that we uncovered over a multiple year period. With tens of thousands of doses delivered in my practice, I can say that I have had more robust results utilizing gabapentin versus amantadine. I still do use amantadine, just not as widely as I once did.
All right. Thank you, Dr. Downing. I'm not seeing any more questions in the Q&A, and we are right on time for ending our webinar. I want to be mindful of everyone's time. Thank you again to our speakers for being with us today, for sharing all of your knowledge. We will be sending out a link to this presentation next week, so be sure to check that out, revisit, share with others. And we hope you have a wonderful day. And thank you again for everyone who attended and to our amazing speakers. Have a great day, everybody.